Good morning, students. This is, I think, 9 or 10 slides presentation on atherosclerosis. The blanket term for these kind of diseases is arteriosclerosis. So, arteriosclerosis is a result of degenerative changes in the arteries, which is characterized by thickening of the vessel walls, and there is accumulation of calcium with consequent loss of uh, the blood vessel elasticity, and also the reduced blood flow. What happens to blood vessels? Uh, the major arteries, they have arterioles. So when the blood is coming from your major artery aorta, the artery gets branched into arterioles, which are small arteries. And these small arterioles, uh, with time, they become hard and they become thick, they become narrow, and there is less blood flow from these arterioles to the target body organ which they supply. So with time, the body organs to which these arterioles were supplying blood get damaged because they're not getting enough blood flow. Then the tissues are not perfusing. So, and why this happens? There are a lot of reasons why this happens, and we'll get to know about one of the diseases which is very common in US, and I think it's found in almost all the states of US, is um, ath atherosclerosis. So it is, the blanket term is arteriosclerosis, and one of the diseases which comes under this is atherosclerosis. So it's atherosclerosis. Yeah. So it starts with not AR, it starts with ATH. Okay. So now the arteriosclerosis, the blanket disease term, or the blanket diseases, they are mostly found in hypertension and diabetic patients. Patients who are suffering from hypertension and diabetes. Why? Because high blood pressure and diabetes, they stress the walls of the arterioles, and it results in thickening of these walls, and thereby again the reduced blood flow. Let's go to the next slide. Uh, so atherosclerosis, it is a common form of arteriosclerosis in which fatty substances form a deposit of plaque on the inner lining of arterial walls, leading to reduced or blocked blood flow. So this is the definition of atherosclerosis. Okay, and the subsequent, or the following slides are all about atherosclerosis, because this is the form of arteriosclerosis which is very common in US, and it's very important that we as nurses and you as future nurses should know about this disease, so we can educate our patients, uh, how to avoid this condition. Now this is the diagram, or this is the picture which shows there is a normal artery and there is a normal blood flow going through this artery, and with time you can see the lumen of the artery in the second uh, artery, which is artery B, how it's getting narrow as the plaque is getting accumulated in the artery. So you can see the narrowed artery and the plaque there. With time, the lumen is getting more and more narrow. So uh, this is how, and it doesn't happen in one day. It doesn't happen in weeks. It happens in many years. There is a full progression scale of the progression scale, or the timeline in which all this happened. It happens in 10, 12, 20, 30, many years, and at one point it happens that the second artery will get completely blocked, and the patient can have a heart attack. So let's go to the next slide. What causes atherosclerosis? So high cholesterol. So that's why there is so much awareness in the community that what we should keep check on our on our cholesterol, because high levels of cholesterol in the blood injures the arteries linings, and when there is high level of cholesterol in the blood, our body's immune system, it causes an inflammatory response, and with inflammatory response, the fatty deposits and cholesterol starts getting deposited more and more in the uh, blood vessels. If there is any infection due to bacteria or any kind of virus, that can also damage the lining of the arteries wall and encouraging some deposits to form. There is something called atheromas. Now, this is a very common term in describing the patchy deposits of fatty material in the arterial walls. Um, Another cause can be repeated injury to the artery wall. Now, there can be if there is too much injury to the arterial wall and it's going on and on and on, then the immune system gets too much involved. And the too much involvement of the immune system allows the materials to deposit on the arteries in a lining, and it keeps on depositing more and more. So it's not, it's it might happen that there is a small injury to the arterial wall and it happened and treatment was done and it gets cured, but due to some any underlying cause or pathology, there is repeated injury to the arterial walls of the heart, then it might lead to too much, it might lead to more fatty materials deposited on the artery's inner lining. So these are the some basic major causes which can cause atherosclerosis. High cholesterol, infection to bacteria or virus, atheromas, and repeated injury to the arterial wall. Risk factors for atherosclerosis: smoking. Yes, definitely, because smoking, why? Yes, well, we have been learning about the risks, about you know, the fatal or the bad results of smoking to the human body, but how smoking leads to atherosclerosis. The important thing to know is that smoking will lower your HDL, the good stuff, the stuff which we want more. The smoking lowers that, and smoking helps in increasing the bad stuff, which is LDL. So we want the high density lipoproteins to grow more, but the smoking will lower it. So it will lower the good stuff, and it will increase the bad stuff. So high cholesterol, now when HDL and LDLs are out of range, they can be high cholesterol. And when there is high cholesterol, the risk of heart attack increases. High BP, um, many times as nurses, we teach how to be compliant to blood pressure medicines, and it sometimes doesn't happen. So uncontrolled blood pressure is also equal to heart attack or stroke. Diabetes mellitus, it has been researched that the risk of developing atherosclerosis is 2 to 6 times higher than other causes, because sugar deposits work the same way as fatty deposits. So the patients who have diabetes mellitus, they also are very high risk for developing atherosclerosis. Now I have a relative who's very old. He's like 78, and he had a heart attack 4 years back, and three of his arteries were completely blocked. And um, he had a go to he went for the he was had a heart attack, and he has diabetes since last, I think, when he was 30 years old. So you see, it doesn't happen in one day, one year, 2 years. It takes a lot of time, decades, for atherosclerosis to develop. And yes, this relative of mine who's around 78 and who had a heart attack has diabetes, has heart attack, has diabetes since the age of 30, when he was 30 years old, and he had his first heart attack at the age of 78. So it took a lot of decades to accumulate the sugar in the uh, blood vessels. Obesity and physical inactivity go side by side. So, when we are eating a lot of fatty deposits and there is no exercise, it's not being burned, it's not being metabolized. Where will it go? It will go in a bloodstream, it will go in a body. So that also leads to a lot of fatty deposits in the blood vessels. There is something called high blood levels of homocysteine. It's an amino acid which directly injures the lining of arteries, thereby facilitating the formation of those patchy fatty deposits known as atheromas. So these are the basic risk factors for atherosclerosis. Let's go to the next slide. Signs and symptoms of atherosclerosis: hypertension and hypertension and hypertension. So many times the uh, hypertension control is very important for patients, because with time the arteries get narrowed due to plaque deposits, and the blood is having very hard time flowing through the blood vessels, and when it is having very hard time, the blood pressure goes high. Now the patient comes to you in outpatient clinic or hospital, you tell him, oh, your blood pressure is high, it's going very high, your diastolic is going now. Diastolic is supposed to be 80, isn't it? I mean, generally it's supposed to be 80 millimeters of mercury. And then you say, oh, in the first visit you tell him, oh, it's your diastolic now 92. You need to control your hypertension, and he ignores it. Then he comes back again, and then you see, oh, it's now 120. So, your diastolic is very high. So what do? We'll might admit him. We might refer him to the doctor. He gets admitted through the ER or something, and then they correct his profession, he goes back home, and again he gets more non-compliant, or something happens, or he doesn't have any resource, and then he has a dangerously high BP, and the dangerously high BP is what is known as malignant hypertension, and it's an hypertensive emergency. It comes suddenly and very quickly. Diastolic blood pressure can go up to 130, and this can lead to an organ damage. So with this patient, if I see this patient there, I'm not letting him go anywhere. He needs to immediately go to the ER. He'll stay in hospital and he will get some IV hypertensive, antihypertensive. So uh, the malignant hypertension is also signs and symptoms of atherosclerosis. Decreased peripheral pulses. There is not much of circulation happening to the arteries uh, in legs or arms. So there will be low peripheral pulses. Angina, arteries are narrow, blood flow is not going, and things happen when the arteries lumen, they go so narrow that the blood is not able to pass, and the patient has chest pain. Leg cramps. Leg cramps is just whatever big arteries you have in your legs. There is a lot of narrowing in those arteries in legs, and the patient has leg cramps, which is popularly known as also intermittent claudication. Stroke. Stroke is blockage of arteries in brain. Heart attack. Arteries are blocked. There is the pump is not working because few of its tubes, arteries, they are not able to circulate the blood. So there is a, and the patient gets heart attack. Kidney failures, the major arteries supplying one or both kidneys with blood, they get damaged. So there is a progressive kidney failure. So all of these are signs and symptoms of atherosclerosis. Test blood pressure. Yes, the most easy and accessible is blood pressure. Monitor blood pressure. We can send the patient for lipid profile, and the aim is to have cholesterol below 200 milligram per dl. Coronary angiography. It will show the location and degree of obstruction or any, you know, circulation not happening properly, and also the condition of the arteries beyond the narrowing point. EKG will evaluate the heart muscle, and if they can see if there is adequate blood supply happening. Cardiac cath, it will confirm that there is arteries are getting hard or not. And there is something called intravascular ultrasound, which views the inside walls of the arteries. There is nuclear imaging. The dye is injected into the heart, and the dye will follow the blood flow of the heart. And it will tell you where in the screen on the image, it will show you where the dye has not reached. That's the area of, like dye will show you the area where there is a blockage. Exercise stress test, it determines if angiography or coronary artery bypass surgery is needed. Holter monitor, it detects the silent ischemia and angina. So the most dangerous is silent ischemia, where it's not showing any signs and symptoms. So these are the tests of atherosclerosis. Um, Treatment, the most easy, the most affordable, and the best is to do it in the beginning stages is lifestyle modification. Low fat, low sodium, high fiber, low alcohol intake, smoking cessation, weight loss, and exercise program. Now, with low fat, low sodium, um, high fiber, low alcohol intake. Now, with this, I would like to say the low sodium fiber is so impossible today because of the advent of a lot of junk food in the market. So, you'll be surprised how in most of the Asian countries where you go in school, like you have in America in school, you have lunch trays given to kids, and you have here, you know, a bun or a patty, and then milk or juice, etc. in lunch here. In most of the Asian countries, when they had lunch, they had vegetables, rice, or something, or bread, or something. Vegetables, rice, bread. Now, due to globalization, in most of the schools in those countries, I'm talking about Asian countries, if you go for lunch, there are stalls of McDonald's, Kentucky Fried Chicken, and all, and kids, they want McDonald's during their lunch break, and they get McDonald's burgers during their lunch break. So the habit of eating vegetables and habit of eating low sodium diet or less processed food disappeared from Asian countries too, and that's why the obesity is becoming high, like epidemic in these countries too. So the lifestyle modification, which is now, which we have been teaching here in US, it's also becoming part of the other Asian countries too, because of the advent of a lot of processed food. And Well, one thing which US has, which most of the other countries, I don't know if they have, is if you go to the supermarket or if you go to a grocery store, you have so many varieties to pick on. You know, you want dessert with low sugar, you know, uh, milk with low fat, low sodium. So we are accessible to so many things which will help us to modify our diet. And but how many patients hear this and how many patients, they follow this is a question, you know. So lifestyle modification is very important. And when you have patients like these, you need to give them some teaching about this, give them handouts, demonstration, also tell them about the weight loss and the exercise program. Um, Medications, all major kinds, nitrates, beta blockers, ACE inhibitors, calcium channel blockers, antihypertensive, antiplatelets, and anticoagulants, they will all help in reducing the blockage of blood vessel, lowering the blood pressure, etc. So all these categories of drugs help in the treatment of atherosclerosis. Procedures which can help, there is something called PTCA, in balloon angioplasty with stent. Now it's a big name: percutaneous transluminal coronary angioplasty. There's nothing to get worried about it. This is just coronary angiography, and the catheter is inserted from your groin, uh, femoral artery, and first the guided wire is inserted, then balloon over it goes inside the artery. That's inflated. The balloon opens the vessel which has a blockage, and balloon compresses the fatty plaque or blockage against the vessel wall to widen the diameter of blood vessel and increase blood flow. Sometimes though in this PTCA, which is coronary angiography, the balloon, when it goes inside when the surgeon inserts the balloon, when the cardiologist, sorry, when he inserts the balloon inside the artery, the balloon is just a medium to open the blockage in the blood vessel, and then the balloon retracts back. But if they feel that if I'm using a balloon to open the blocked artery or the blocked blood vessel, if I'm using the balloon and if I retract back, the blockage will come back. They will leave something inside the artery which is known as stent. A stent is just a mesh. It expands the size of the artery and holds it open. So that is called balloon angioplasty with stenting. Let's get to the next slide. Review this link on YouTube for better understanding. YouTube has a lot of videos on PTCA and balloon angioplasty. So the thing is, with PTCA and balloon angioplasty, PTCA is nothing. There is a catheter inserted from your femoral artery, mostly from femoral artery, into the blood vessel, and there is a guided wire which goes through the catheter, and over the catheter then a balloon goes, and then balloon is inflated where the blockage is, and it will push back the blockage from the artery and will make a way for the blood to flow. And sometimes what they do is they will take help of balloon to open the artery, and they will retract the balloon back and will leave a mesh in that vessel which will keep the arteries open. So when you see this on YouTube with different animations, it might help you to understand better. What can be dangerous for this patient? All the important biggies like stroke, malignant hypertension, kidney failure, peripheral arterial disease, and heart attacks. All these are fatal for this patient. So these are the 11 sites about about atherosclerosis, and If we go back, let's go back. Arteriosclerosis. For arteriosclerosis, I'll be happy if you know this, that it's a blanket disease term, okay? And then we discussed in detail about atherosclerosis, the definition, and then the causes, then the risk factors, and the signs and symptoms, tests, and then tests were on 2 slides, and then treatment, and then balloon angioplasty. Okay, so I hope it will be okay. Yes, I will post one big PowerPoint with audio on CAD, and then there will be one on infective cardiac diseases. It will be shorter like this. Okay, so thank you. Happy studying.